Welcome to the Deep Dive, where we take the dense material you need to know and turn it into actionable, engaging knowledge.
Today we are opening up Chapter 21, Spirituality and Healthcare.
And if you are currently working your way through nursing studies or clinical practice, you know that healthcare is rarely just about chemistry, anatomy, and, bones.
Not at all. It's messy, it's emotional, and fundamentally it's existential.
That's absolutely the core professional issue we need to address today, isn't it?
It is. Our mission here is to understand precisely why spiritual care is not some niche or optional service, but an intrinsic core professional responsibility in contemporary nursing.
Okay, so what does that mean in practice?
It means we need to develop a working definition of spirituality, clearly distinguish it from formal religion, and describe the recognized diagnosis of spiritual distress.
And also look at the research supporting these spiritual practices, right?
Exactly, and connect it all to holistic modalities like, say, therapeutic touch.
So why this topic? Why now? Why is it so vital for the nursing profession specifically?
Because as nurses, you encounter clients during what our sources call the rough spots along the trail.
I like that phrase, the rough spots.
Yeah. We're talking about acute crises, long-term debilitating illness, profound grief, and of course, the approach of death.
And those rough spots are exactly where the holistic nursing perspective becomes, well, essential.
Indispensable. Holistic care defines the person as a biopsychosocial being, yes, but crucially, it asserts that the person possesses a central, animating spiritual core.
Right. And if you can picture that conceptual model figure 21.1 in the text, it really lays it out.
It does. It shows the mind, body, and spirit components as completely integral. They influence each other constantly.
So if you try to treat a physical illness, but you ignore that spiritual core,
you are fundamentally failing at holistic care. And since nurses are the professionals who spend the most continuous time with clients, spiritual care falls uniquely and directly within the nursing domain.
that concept of vulnerability you mentioned it's just so key. Our lives are marked by these inevitable transitions.
Birth, puberty, illness, loss, old age, death. Every culture recognizes them.
But when an acute illness or a profound loss hits, that's where the insights from developmental crisis theory become so relevant.
Yes, because developmental crisis theory teaches us that these transitions are inherently times of acute anxiety, stress, and vulnerability.
And it's not just the client, right? It's the whole family system.
The entire family system. When faced with mortality or severe chronic illness, clients and families often re-examine every foundational belief they've ever held.
They might actively seek out spiritual support, or they might feel the complete opposite.
Exactly. Profound spiritual abandonment. A feeling of being punished or just completely lost.
So when a nurse is allowed into that family system during those moments,
you hold what the text rightly calls a sacred trust. The professional challenge is recognizing that intense vulnerability and providing the framework to help them navigate the spiritual questions that just inevitably arise.
that's sacred trust. It really elevates standard bedside care into something much more profound, doesn't it?
It really does.
Okay, so let's unpack how Western healthcare even got to a point where this spiritual core was almost excluded. Because historically, Western culture, and therefore, the nursing profession, tried really hard to sideline spirituality.
Right, in favor of pure, measurable science.
We have to trace this arc, starting with that historical shift that really ramped up after the Enlightenment in the 17th century.
And that historical arc is such essential context. That period stretching deep into the 20th century, it saw this widespread, almost religious belief among educated Western cultures that science and technology held all the answers.
All the answers to human suffering.
All of them. Think of the excitement around so-called magic bullets.
Like antibiotics.
Exactly, antibiotics. They cured previously fatal diseases and dramatically reduced suffering. The underlying message was basically, we don't need faith, we have chemistry.
And that context is absolutely vital for understanding professional nursing history.
It is.
Nursing, as a field, was striving to establish itself as a credible modern profession, separate from the old religious orders.
So it eagerly embraced the Western scientific method for its theoretical base. The belief was that only rigorous, hypothetico-deductive, quantitative research could provide a legitimate foundation.
So anything that couldn't be quantified.
Like faith, or prayer, or intuition.
It was pushed to the fringe.
Completely.
Yeah.
And yet, as we entered the 21st century, major global events, terrorism, global warming crises, natural disasters, and ironically, even the super scientific act of mapping the human genome.
All of that forced a profound reconsideration.
It did. Science and technology, instead of solving all human problems, were often contributing to new ones. And this prompted this urgent philosophical question. What does it mean to be fully human in the universe as it is now understood?
This pushback against rigid physical reductionism leads us to this idea of reintegration.
And oneness, yes. Healthcare, particularly nursing, started realizing that true healing requires the reintegration of the physical, the mental, and the spiritual.
So it's a return to holism, but this time with modern scientific knowledge sort of backing it up.
Precisely. This growing awareness involves a shift toward a consciousness that individuals are connected not just to their immediate family, but to all people and to the whole of creation.
A genuine sense of oneness.
Yes. And what's fascinating here is that this shift is often reported by people who have experienced severe injury, illness, or near-death experiences.
And what's the result of that shift?
The result can be profound changes. They start viewing life events less personally, they see similarities in all people, their compassion heightens, they engage in more altruistic acts, and they find new meaning and joy.
This change, spiritually, is often seen as the essence of becoming more fully human.
That's right.
And this whole philosophical shift, this idea that science doesn't hold all the answers, has concrete professional implications for how nursing even conducts its research.
Absolutely. The rise of postmodern philosophy brought with it the idea that truth, particularly lived truth, can be relative, which allows for an appreciation of diverse perspectives.
We're talking specifically about the emergence of phenomenology in nursing science.
Yes, since the mid-1980s. When we say hypothetico-deductive quantitative research, we mean testing hypotheses with numbers and stats. Phenomenology just flips that on its head.
It's a philosophical approach.
It is. It appreciates diverse perspectives on truth. It advocates the view that consciousness profoundly determines reality and truth in space and time.
Okay, wait a minute. If the goal for decades was to make nursing purely scientific, how does embracing this idea that truth is relative, this postmodern concept, actually help nursing's credibility? Doesn't that seem counterintuitive?
It's only counterintuitive if you think of science in purely materialistic terms. For nursing practice, this philosophical shift is crucial. It means recognizing that the client's observations and their rich descriptions of their life transitions,
It's their lived experience.
their lived experience may actually be more objective and hold more unique truth than the nurse's clinical assessment alone.
How so?
Well, the client is attached to this rich history of past experiences, and their perspective is often more complete than the nurse's snapshot view. This philosophical expansion is precisely what ran parallel to the increased acceptance of intuition, spirituality, and alternative therapies.
So it allowed the spiritual core back into the professional domain.
By valuing that qualitative experience, yes.
So the shift to phenomenology fundamentally respects the client's internal reality as a critical data point for healing. That's a massive evolution in how we define evidence.
It's huge.
Okay, so if we've established that spirituality is essential and professionally recognized, we really have to pin down what we mean by it. Our sources acknowledge that spirituality is a broad, maybe somewhat nebulous concept.
It is, but it centers entirely on the search for answers to fundamental, universal questions.
Those questions are potent, aren't they? They're just relentless.
They're the bedrock of human thought. Why are we here? How do we make meaning of suffering and hardship? What happens when we die? How are we supposed to behave toward others?
And what's fascinating is that research into the spiritual development of children, it identifies these same core concerns.
Which proves they are innate human drives. This isn't something we just learn later in life.
And this search for meaning isn't just modern psychology. It has this profound historical heritage.
Oh, absolutely. We can trace the roots of systematic reflection for growth and wholeness back to a huge shift in human consciousness that happened around 500 BC.
Often called the axial age.
Yes. That period was a philosophical supernova. It saw the simultaneous emergence of figures like Confucius and Lao Tzu in China, the Buddha in India,
The Greek philosophers, Socrates, Plato, Aristotle.
and the Hebrew prophets Amos, Hosea, Isaiah. All of them, independently, were seeking to understand the human experience, universal laws, and how to live a meaningful life.
And even later, in the 5th century, you have someone like St. Augustine identifying the relationships among contemplation, action, and wisdom in the Christian tradition.
Ultimately equating the discernment of truth with God. It's a long, rich history.
So pulling from all these diverse traditions, how do we define the essence of spirituality for, professional practice?
It's often defined as integrative energy.
Integrative energy.
Yes, the energy that produces internal human harmony and holism. It's also described as a sense of coherence, a feeling that the universe and your place in it makes sense even when you're suffering.
And the central components consistently include things like hope.
A sense of transcendent reality, drawing strength from inner resources, and having an inner knowing.
You also emphasize compassion and empathy as crucial spiritual elements.
We have to pause on compassion because it is so vital to spiritual care. The Greek word for compassion literally means to feel in one's innards.
Wow.
It is sensitivity to the suffering and brokenness of others, and it's born out of this profound awareness of one's relationship to all living creatures. This isn't just pity, it's a deep, integrated knowing of our shared humanity.
So in reviewing modern interdisciplinary literature, our sources found a consensus on 4 emergent themes that can ground a working definition of spirituality. What are those key takeaways?
These 4 themes are the common denominator that professionals can really rely on. First, all humans, regardless of culture or creed, have the potential for spirituality and spiritual growth.
Okay, that's universal. What's second?
Second, spirituality is fundamentally relational. It connects us to others, the universe, and the transcendent. Third, there is an inherent link among religion, moral norms, and spirituality, as these traditions often provide ethical guidance.
Seen before.
And fourth, spirituality involves lived experience. It is a way of life, not just a set of Sunday beliefs.
So if you combine those 4 themes, the text offers a pretty solid composite working definition for the nurse.
It does. Spirituality is a way of life, usually informed by the moral norms of one or more religious traditions, through which a person relates to others, the universe, and the transcendent in ways that promote fulfillment and universal harmony.
Now, here is where we need to be crystal clear for professional practice. Spirituality is often mistakenly equated with religious practice.
But the two are distinct. Religion is simply an expression of spirituality, but it's not the whole of it.
Let's break down the religious perspective first. This often encompasses the ideology of the imago Dei.
Which literally means the image of God, or the concept of the soul. This belief makes a person a moral, creative being able to relate meaningfully to a supreme being, whether that's called God, Allah, or the divine mystery.
And a religious perspective provides a structured creed, right? A set of beliefs that helps explain the meaning of life, suffering, health, and illness.
It does, and it mandates positive values like charity and faith. However, there's a significant professional pitfall here that nurses must recognize.
Which is what?
Some religious adherents believe that correct, rigid adherence to rules and norms guarantees specific rewards, like health, success, or affluence.
That sounds like a prosperity gospel view. And if adverse events happen, like a major disease diagnosis or the death of a child, it must be absolutely devastating.
It is. These individuals perceive the adverse event not just as a tragedy, but as a personal failure in their religious practice, or, even worse, as punishment from God.
Understanding that potential connection between adherence and perceived failure is crucial.
Because it's a fast track to spiritual distress.
So conversely, we have the secular perspective. This is often misunderstood as being anti-spiritual.
But it's not. It's actually a philosophical approach that protects the individual's right to be free from the governmental or institutional imposition of organized religion.
That's a crucial distinction.
It is. It separates formal religion from government, but it fosters its own profound form of spirituality, one without an external divine being or religious structure. Secular spirituality emphasizes positive, universal values.
Love, honesty, truth, justice.
Exactly. These values are chosen by the individual as their supreme focus and organizing framework, and they seek inner peace and universal harmony. It goes beyond the purely materialistic, but it doesn't necessarily require belief in a divine being.
To help us categorize where a client might be in their search for meaning, the source material introduces 4 proposed developmental stages for spiritual growth. Listing them quickly doesn't really do them justice. How do they help the nurse in practice?
Well, these stages help us appreciate the complexity of the client's spiritual core. The progression starts with stage 1, the chaotic, antisocial stage.
What does that look like?
This is characterized by a superficial, often self-serving belief system. A person at this stage might only seek comfort or help when things go immediately wrong for them, without any deep internal moral compass.
Then it moves to stage 2, the formal institutional stage.
Here, adherence to the law and the rules of a specific religious system is rigid and central. They might struggle significantly if a treatment or procedure violates a literal interpretation of a rule, regardless of the medical outcome.
So the nurse needs to respect that adherence, but also see its potential for conflict.
Exactly. Next is stage 3, the skeptic individual stage.
And this stage emphasizes rationality, materialism, and humaneness.
Right. People here may reject formalized religion entirely, focusing instead on observable, measurable facts, but their spirituality manifests in deep humanism, valuing justice, love, and human dignity above all else. They're often highly skeptical of supernatural claims.
And finally, the highest stage is stage 4, the mystical communal stage.
This is a focus on the unseen order of things. It suggests a profound sense of connection, transcendent reality, and universal harmony. Individuals here typically embrace deep compassion and understand their interconnectedness with all creation.
Understanding these stages allows the nurse to truly meet the client where they are spiritually.
Without making assumptions or pushing for belief systems the client isn't ready for.
Let's turn to nursing history now, because modern nursing, in its push for scientific credibility, often downplayed its deep spiritual tradition, starting right with its founder, Florence Nightingale.
Right. Nightingale's professional views were founded upon the sophisticated spiritual philosophy she articulated in her book, Suggestions for Thought.
Her background: a Unitarian and Anglican upbringing, deep familiarity with Christian and Eastern mystics, including texts like the Bhagavad Gita. It shaped her concept of care fundamentally.
And she realized her vocational call to care very early on. She trained at Kaiserwerth, a Protestant training hospital that explicitly taught nursing as a call from God.
So this was not a secular pursuit for her at all.
Not in the slightest. And for Nightingale, there was absolutely no conflict between science and mysticism. Her belief system was that a divine intelligence creates and sustains the cosmos, and the universe itself was the embodiment of a transcendent God.
Which makes all creation fundamentally interconnected.
Yes. She famously believed the laws of nature and science were merely the thoughts of God.
That's such a powerful professional lens.
Yeah.
If the laws of nature, the things we study in anatomy and chemistry, are the thoughts of God, then spiritual care isn't secondary.
No, it is foundational to understanding the laws of healing.
It absolutely elevates the entire practice.
It does. For Nightingale, spirituality involved developing God-like qualities like courage, compassion, and insight. Her own practice included contemplative prayer and attunement to inner presence as essential professional acts.
And this spiritual perspective directly informed her definition of the nurse's role in healing.
Which was that she saw physical healing as a natural process regulated by these divine natural laws.
Therefore, nursing's job.
As she stated clearly in her notes on nursing, is simply to put the client in the best condition for nature to act upon him. It was about facilitating natural, divinely regulated processes, not replacing them.
But moving into the mid-20th century, we saw a distinct shift away from that tradition. As nursing professionalized, we learned that out of over 26 major nursing theories, 14 recognized the spiritual domain.
But only 2 actually named it explicitly.
Martha Rogers' Science of Unitary Human Beings is the classic example of this profound spiritual avoidance.
It is. Her concept of unbounded human energy fields interacting with environmental fields is inherently spiritual. She's talking about oneness and interconnected energy, but she avoided using the word spirituality directly.
Why?
Well, this strategic omission was likely due to the context of the 1950s, when nursing was aggressively fighting for scientific acceptance. Being labeled spiritual or mystical could have undermined that entire cause.
So the theories had the content, but they sterilized the language for professional acceptance.
Pretty much. Only Betty Newman, in the later development of her theory, and Jean Watson clearly acknowledged and incorporated spirituality.
And Watson went the furthest.
She did. She specifically defined spiritual terminology and made spiritual care a professional mandate. She requires that nurses identify and respect clients' spiritual and religious beliefs.
And this includes active facilitation of those needs.
Yes, things like lighting candles real, or electric providing privacy for prayer, ensuring access to religious objects, or playing culturally appropriate music to promote comfort. This is where the professional expectation becomes concrete and mandatory.
This concrete expectation leads us directly to a key professional concept established back in 1978 by NANDA.
The North American Nursing Diagnosis Association.
The nursing diagnosis of spiritual distress.
Right. Spiritual distress is a formal diagnosis defined as disruption in the life principle that pervades a person's entire being and integrates and transcends one's biological and psychosocial nature.
So it's an internal crisis where that sense of coherence we talked about,
Mm-hmm.
that integrative energy,
Severely fractured, yes.
and the defining characteristics for this diagnosis are incredibly important for nurses to recognize because they don't always look overtly religious or spiritual.
Oh, absolutely not. They can manifest as purely psychological or behavioral issues.
Such
The list includes things like expressing concerns about life and death meaning, voicing anger toward God, actively seeking spiritual help, being unable to participate in preferred religious practices.
and even concerns about the ethics of medical regimens, especially if they conflict with a belief.
Yes, or preoccupation with illness, displaced anger toward clergy, and even basic things like sleep disturbances. That sleep disturbance might be a physical manifestation of a spiritual crisis.
So this diagnosis really recognizes that the spiritual core is under attack. We see this play out in challenging practice scenarios, and one major area our sources highlight is when clients have been harmed by religious communities.
This is tragically common. Clients may have been shunned, excommunicated, told their illness is a punishment for sin, or even suffered physical or emotional abuse within a controlling religious group or cult.
For those clients, any offer of standard religious support could be profoundly threatening.
Deeply. And they often feel a deep sense of abandonment by their community and by God.
Given the high-pressure, rapid turnover in modern healthcare environments, what is the best professional intervention for a nurse facing that high level of spiritual pain?
Often the intervention has to be basic and fundamental. The nurse needs to acknowledge the spiritual pain and accept the client without judgment, maybe offering only the simple, powerful assurance, I am here for you now.
Just establishing human connection and safety.
Exactly. And if the situation permits more time, referral to appropriate support groups or specialized non-sectarian clergy or counselors is necessary. The nurse is a facilitator of healing, not the provider of theological answers.
Another conflict arises when clients make necessary healthcare decisions that clash with the beliefs of their religious communities.
The case study of the woman seeking a therapeutic abortion is a powerful, heart-wrenching illustration of this spiritual distress.
It's a critical teaching moment. This woman needed an abortion due to severe medical complications. She was Rh negative, carrying an Rh positive baby, and she had only one remaining kidney.
So the continuation of the pregnancy jeopardized her ability to care for her existing son. The termination was a medically sound and rational decision.
And yet, her clergyman told her she would go to hell.
Which is just placing an unbearable weight on an already suffering individual.
So how did the nurse intervene effectively to relieve that extreme spiritual distress?
The nurse's intervention was a perfect example of spiritual care competence. She recognized the acute spiritual distress, the anger, the fear, the perceived punishment, and immediately requested the hospital chaplain.
And the chaplain spent several hours with her.
Talking and praying with the woman, providing theological comfort, and helping her reconcile her decision with her relationship with God. It ultimately brought great comfort and peace before the procedure.
That really highlights the nurse's role, not as a theological authority, but as a critical facilitator and protector of the client's spiritual peace, even when it conflicts with powerful external religious pressures.
And we see this issue frequently in end-of-life care, too.
Refusing blood transfusions due to religious beliefs, or in those agonizing legal conflicts like the Terry Schiavo case, where people with strong religious beliefs find themselves diametrically opposed on life-sustaining treatment.
It's a minefield.
Okay, shifting our focus a bit, we've seen how spiritual conflict impacts decision-making. But how does the body process spiritual healing? We have to look at the idea that grounds many of these practices, the nature of the soul and energy.
Right. The concept of the soul exists across virtually all religious traditions, but it doesn't have to be religious.
And this is where Thomas More's perspective becomes valuable.
He describes the soul not as a thing to be saved, but as a dimension of experiencing life involving depth, value, relatedness, heart, and personal substance. Spirituality is the effort a person makes to identify the soul's worldview.
The work of the soul.
That's the quest for deeper understanding and insight about major life questions, irrespective of formal creed.
And the source material posits the soul as an exquisite energy center for communication, unrestrained by the laws of physical matter.
Yes, capable of communicating with others and the divine source of all energy. This is the concept of the life force.
Which is global.
Global and foundational to holistic healing. It is called qi in Chinese traditions, ki in Japanese, and prana in Indian traditions. These are not just abstract words, they represent the flow of vital energy that animates and connects us all.
And the therapies that rely on this knowledge of the soul and the movement of this life force energy are central to alternative healing modalities.
Precisely. We're talking about therapeutic touch, TT, Reiki, and Shiatsu. The underlying principle is that this universal energy can be drawn from its divine source, moved between people, and balanced throughout a person's energy field to achieve health,
Or at least harmony.
or at least harmony.
To understand the flow of this energy, we look to Eastern concepts like the chakras.
The Hindu and other Eastern traditions teach that the human energy system contains 7 primary energy centers, or chakras, which are openings through which energy flows.
And each center controls a unique type of energy and is related to a different aspect of spirituality or physical being.
That's right.
Can you elaborate on the contrast between two of these centers?
Certainly, the root chakra, located at the base of the torso or perineum, relates directly to the material world, survival, security, and physical manifestation.
And the crown chakra.
The crown chakra at the very top of the head represents the highest level of energy and relates to spirituality, transcendence, and divine connection.
And it is fascinating that religious art across millennia reflects this archetypal recognition.
You see it everywhere. Holy people depicted with vivid hearts or halos around their heads, intuitively pointing to the power of these energy centers.
Moving further into this unseen realm, nurses often have opportunities to witness what are sometimes called communication between worlds, specifically near-death experiences, or NDEs.
NDEs have been documented across cultures and history, gaining significant credence among Western health professionals since the early 1980s, largely thanks to rigorous documentation.
And the common elements are remarkably consistent.
Incredibly so. Floating above the physical body, traveling rapidly through a tunnel, moving toward a bright light, often identified as God or pure love, and sometimes communicating with that light being about returning to the body.
And the professional implication of this is huge. Individuals who return from an NDE often report a profound inner peace.
They lose their crippling fear of death and experience fundamentally transformed lives, often becoming more compassionate and altruistic.
And for nurses, particularly hospice nurses, there is the deeply moving phenomenon of deathbed visions.
Yes. Dying clients become aware of multiple realities, often seeing the other side where deceased loved ones are waiting for them. The nurse is often a key witness to this moment of transition, confirming that the client is not alone or frightened.
Of course, we have to acknowledge the scientific debate here. The reductionist interpretation is what?
That some medical researchers attribute NDEs and deathbed visions to progressive hypoxia, lack of oxygen in specific brain centers, or a sudden release of endogenous chemicals.
The purely physiological explanation.
Yes. However, many others give them a spiritual interpretation, challenging that view by asking, for example, why the visions are so consistent across cultures, or how a husband who died years ago could appear to his wife in a moment of crisis.
The literature around spiritual guides reinforces the idea that people need not feel alone or frightened during crises.
Because help, whether divine or simply energetic, is available for the asking.
It seems that children are considered particularly receptive to this spiritual world, perhaps confirming the idea that this capacity is innate.
Many Unaris believe children are naturally more open to communication from the spiritual world because they have not yet been contaminated or limited by the rigid laws of natural science.
They express their spirituality naturally through their behavior.
Deep awe of nature, imitation of ritual, use of symbols and imaginative play, art, dance, and making clear value judgments about right and wrong. When that's supported, this spiritual expression creates a robust framework for understanding social relations and the natural world.
And finally, rounding out these concepts of energy and the soul, we have the mystics.
People who seem to have a fundamentally different relationship to time, space, matter, and energy.
They're believed to possess the deepest understanding of their own souls and can apply that knowledge to the physical world, producing changes that science struggles to explain.
What some would call miracles. Examples include the Hindu holy man Sai Baba generating sacred ash that brought healing, or the documented healing miracles of Padre Pio.
It's fascinating that after exploring all this, complex energy fields, brain chemistry, documented miracles, the universal core message shared by mystics globally remains utterly simple.
Love and compassion. People are called to live lives of universal love and compassion. That simplicity amidst such complexity is a powerful professional takeaway.
Now we transition into the most actionable and professionally focused part of this deep dive, the direct interventions and the nurse's specific responsibility.
And the text is clear. Care of the spirit is an intrinsic part of holistic nursing and therefore a non-negotiable professional duty.
To perform this role effectively, the nurse needs a specific set of professional skills.
Confidence in spiritual assessment, strong open communication skills, the ability to build profound trust rapidly, and above all, the capacity to give appropriate hope.
This requires tremendous self-awareness, sensitivity, and open-mindedness.
Especially for new nursing students, yes.
What is the constant, persistent barrier to integrating this care into clinical practice?
It's the fear of imposing one's own religious beliefs and values on others. In a diverse, postmodern society, nurses are terrified of being perceived as preachy or judgmental.
This fear is natural, but the text offers a crucial counterpoint that addresses that anxiety directly.
And the counterpoint is this. The more grounded a nurse is in their own spirituality, their own self-knowledge and personal reflective practice, the less likely they are to impose their values on others.
So self-awareness provides the necessary boundary.
It does. A nurse acting from a foundation of personal spiritual certainty is not the same as imposing those beliefs.
So assuming the nurse is grounded, how do they assess the client's spiritual domain without relying on sectarian religious questions?
The text provides concrete, open-ended questions that focus on inner resources. These are key, non-denominational assessment tools.
They open the door to discussing the client's spiritual core.
By focusing on where the client finds meaning and resilience, what is strength for you? Who gives you strength? What does peace mean to you? When do you feel most secure?
These questions bypass religious affiliation and go straight to the spiritual source of coherence or distress.
Exactly.
Let's look at specific concrete interventions, starting with common spiritual disciplines like prayer and meditation.
Nurses must be deeply sensitive to the personal nature of these disciplines. Facilitating prayer means helping clients recall or explore ways they reach out to or listen for God or the absolute.
And this requires actively arranging environmental changes.
Ensuring privacy using inspirational readings, facilitating soft music or light, or placing personal religious objects nearby. If a client specifically requests it, the nurse may even pray with them, or invite others to pray for them, provided they are comfortable and non-judgmental.
And if a client is physically confined, imagery becomes a powerful tool that the nurse can teach them to use.
Imagery is fantastic because it enables the confined client to experience a sacred space, a temple, a vast ocean, or a comforting place of worship mentally. It makes them feel more comfortable and able to engage in prayer or meditation.
A related practice is visualization.
Right, which involves meditating with an image of a desired outcome, like visualizing miniature miners physically removing a tumor to help the body's own healing mechanisms.
The source material also discusses a specific research-supported practice, sometimes called transcendental meditation or mantra meditation, known by the general term the relaxation response.
This is a structured, scientifically proven technique. It requires 20 minutes, twice daily, with eyes closed, focusing on a single word or image that is spiritually meaningful. A mantra. And when intrusive thoughts appear, the person lightly dismisses them and returns to that focus word.
And research has shown tangible physical benefits.
It has. Individuals who practice this consistently experience lowered blood pressure, decreased incidence of dysmenorrhea, reduced chronic pain, and overall lowered metabolic function, promoting deep rest and healing. This is a practice the nurse can champion with confidence because of the evidence.
The role of mental state in healing is further reinforced by the importance of emotional release, specifically forgiveness.
This is a critical spiritual intervention. Research has observed that seriously ill people sometimes internalize the belief that they deserve their illness as punishment for past actions or perceived sin.
Helping them achieve forgiveness of themselves or others often brings about dramatic physiological improvements.
It does. Releasing long-held fear and hate has a similar effect on the body. This aligns perfectly with Nightingale's core view that the nurse needs to help clients get out of the way of their own healing.
So spiritual healing is broader than a physical cure.
It includes enhanced comfort and inner peace with disability or even with death.
This brings us to a critical professional concept that highlights the physiological power of belief systems in healthcare: remembered wellness.
Also known as the placebo effect.
Right.
Remembered wellness uses the deeply rooted source of healing power based on the belief that all people can remember a state of emotional and physical health. It requires three synergistic components:
Which are?
the belief and expectation of the client, the belief and expectation of the caregiver, and the belief and expectation generated by the caring relationship between them.
So nurses promote this by subtly reinforcing positive expectations.
Referring to a medication as the drug your doctor prescribed to dramatically help your heart, reinforcing positive expectations rather than dwelling on adverse effects.
The dark side of this, then, is the nocebo effect.
The fulfillment of an expectation of harm.
So this occurs when a health professional unintentionally causes harm by suggesting an intervention will likely make the client sick.
Or telling them chemotherapy will absolutely drain their energy. Or meticulously detailing all psychological side effects like headaches and back pain, thereby manifesting those symptoms through suggestion.
This creates an extremely difficult ethical dilemma for nurses.
You're caught between the obligation of beneficence, to do good and prevent harm, and the obligation of informed consent, full, complete disclosure.
That is a true professional conflict. If telling the truth about potential side effects might trigger a nocebo effect that causes real suffering, but withholding the information violates informed consent. What middle ground is proposed?
Some experts propose contextual informed consent. This involves adapting the information provided to the client's specific level of knowledge and anxiety, strategically avoiding detailed discussion of minor psychological side effects that might trigger the nocebo effect.
The goal is harm reduction.
But other experts worry intensely that this approach invalidates the consent process and destroys the trusting relationship built on full disclosure. It's an ongoing debate that demands nurses operate with extreme ethical consciousness.
Speaking of challenges, let's dive into an alternative healing modality that is directly integrated into nursing practice. Therapeutic Touch, or TT.
TT is an active alternative healing modality that involves redirecting the human energy system. Its professional framework is entirely consistent with Rogers' science of unitary human beings.
So it defines people as complex energy fields characterized by wave patterns.
And TT seeks to alter and synchronize these wave patterns to stimulate healing.
How does the nurse practitioner execute TT? What is the process?
The process has three distinct steps. First, the practitioner must center themselves, approaching the client with profound compassion and the specific intent to heal.
Okay, and second?
Second, they assess the state of the client's energy field and chakras using their hands, usually held a few inches above the body, or with visualization or intuition. They're searching for areas of congestion or turbulence.
And third?
Third, they direct energy. And this is crucial. It's energy drawn from the environment or the universal source, not their own personal energy, into the client's field. They stimulate flow, clear congestion, dampen excess activity, and synchronize the rhythmic waves based on the client's spiritual needs.
That seems like an intensely spiritual practice, requiring deep presence. Finally, TT aside, there is the simplest spiritual intervention, which is often forgotten in the high-tech hospital environment.
Basic physical touch.
Right.
Touch is the most fundamental, powerful expression of the spirit when words fail. Nurses must actively encourage family and friends in the intimidating hospital environment to share physical expressions of care.
Simple acts like holding a client's hand.
Giving a gentle back rub, or even just brushing hair, can be profoundly healing and reinforce the caring, spiritual relationship, bridging the gap between the physical and the transcendent.
As we conclude this deep dive, we have to address the professional identity of the nurse, connecting the circle all the way back to Nightingale.
Yes, modern nursing has often tried to distance itself from its religious roots, shifting from a vocational life calling to an economically oriented profession.
And the current healthcare system, focused on economic efficiency and metrics, requires this identity shift to achieve value in a capitalistic structure.
But there is a strong argument for reevaluating nursing as a vocation, a spiritual calling that goes beyond the paycheck.
When nursing is practiced mindfully, with deep consciousness and purpose, the text notes it is richly imaginative and nurtures both the client and the nurse.
It speaks directly to the soul.
The choice of nursing might feel serendipitous, but in a spiritual context, it may not happen by accident. The nurse, by engaging in this work, undertakes the soul's lifetime work of self-definition. But what happens when that purpose, that spiritual calling, is lost or overwhelmed?
That leads directly to burnout, which we have to view primarily as a spiritual issue.
Burnout.
Burnout is often described as the person experiencing the well running dry, where energy fields become profoundly unbalanced or they enter a prolonged dark night of the soul.
Because helping professionals are rooted in compassion and empathy, they expend immense spiritual energy,
making them highly prone to depression and burnout.
So the spiritual core that nurses must fiercely protect in their clients is also the one they must fiercely protect in themselves. It's all about maintaining balance.
Among the mind, body, and soul. Because of the deep interconnection, which we saw in figure 21.1, imbalance in one affects the others.
Mental stress causes physical symptoms like ulcers.
And physical illness causes spiritual anxiety and depression. To maintain internal balance, nurses must make a concerted effort at self-restoration to feed their spirit.
We can't just list these strategies. We need to tie them to a busy professional life. What are the specific strategies recommended for self-restoration when you have high-stress 12-hour shifts?
Daily prayer or meditation for even 10 minutes is fundamental for insight and energetic centering. Secondly, belonging to a spiritual growth community is powerful.
A lot of people seek a new faith or growth community in midlife when their prior beliefs no longer sustain them.
They do. And third, periodic retreat, whether for a few hours, a half day, or a weekend, is essential for introspection and reflection, not for completing tasks.
So this means journaling or walking mindfully in nature.
Yes. And finally, infusing everyday life with a sense of sacredness. This seems like the most portable form of self-care.
It is. This involves celebrating seasonal and family holidays with intentional rituals, enjoying simple beauty in the world, or maintaining special, non-negotiable routines.
Like sitting in a favorite chair with a cup of tea, or the act of making bread.
This is where personal creativity and insight are most evident. However, the text issues a sharp professional critique here.
It does. The intense pressure to multitask, the 21st century buzzword, is the direct antithesis of spiritual nurturance.
Multitasking leads to fragmentation, which is the enemy of wholeness.
And if nurses are fragmented, they lose the capacity to be fully present. To achieve that synergistic, holistic moment with clients and loved ones, nurses must consciously slow down and center their energy fields.
That act of intentional presence is the ultimate form of self-care and professional efficacy.
It truly is.
That brings us to the end of this incredibly detailed deep dive. Let's quickly recap the most important professional takeaways from Chapter 21.
First, remember that spirituality is a broad concept focused on the search for meaning in life, and it is distinct from religion, which is just an institutionalized expression of it.
Second, nurses must be acutely aware of the many manifestations of spiritual distress.
From anger toward God to intense ethical conflicts over medical care.
Third, spiritual care is not optional.
It is a core professional component of holistic nursing and requires confidence and competence.
Fourth, the powerful concepts of remembered wellness and the nocebo effect demonstrate the direct physiological impact of belief systems on healing outcomes, demanding extreme ethical consciousness from the caregiver, especially regarding informed consent.
And fifth, nurses have a professional and personal obligation to nurture their own spirituality, to avoid burnout, and to be fully present for their clients, embodying that synergistic, holistic moment as seen in Figure 21.2, where spirituality, presence, and relationship combine for an effect greater than the sum of their parts.
And that leads back to the complex situation you, the learner, might soon face. The chapter introduced the case of Mrs. Steiner, who is near death.
She has two daughters. One is a practicing Roman Catholic, one is a Unitarian, who are in conflict over end-of-life care. And the patient herself had converted to Judaism years ago.
Considering that tremendous religious divergence within one family system, what is the nurse's ultimate professional role in facilitating communication?
Is it to champion one daughter's perspective, or is there merit in providing a non-sectarian approach? Allowing her death to be handled in a neutral, non-sectarian way might permit all relatives and friends to mourn privately in accordance with their own spiritual traditions,
thereby preventing further conflict and maintaining the peace.
It's a profound ethical dilemma about facilitating peace in a polarized world. Something to deeply consider as you take on this sacred trust.
A truly challenging thought to close on.
Yeah.
That was an incredibly thorough and necessary deep dive into spirituality and healthcare.
Indeed.
And with that, thank you for joining us for this deep dive into the source material. It's a warm thank you from the Last Minute Lecture team.